So when we're approaching the driving evaluation, it's not a driver's test. What we're assessing is a person's safety and independence with using a modification to operate a vehicle. And that's really what we're looking at. So how do driving evaluations work? It's typically initiated from driver fitness and monitoring. It can be initiated by your physician. If you're a WCB and you've got a case manager, it can be initiated by your case manager. And after we get the referral, we also have access to any medical that we may need. If it's somebody, referring themselves from the community, then we will ask your permission and get some medical information from you. Just what are some of the things that are posing the barrier? Have you had any rehabilitation? Have you reached your maximum medical improvement? That sort of stuff. After that, we will schedule a driving evaluation. It typically has to happen in a dual brake vehicle with an on-road evaluator and myself, an occupational therapist, present in the vehicle. And so we're basically taking notes on, how the individual is performing using the different adaptations. If there's other things that we can suggest that might be better, then we'll do that. We provide education while we are completing the assessment with the client. And we'll often try different steering wheel modifications if we think there might be a better choice than one. And we'll just kind of see how the individual does with that. The other thing is, how are they transferring in and out of the vehicle? Is that something we need to look at? Can they manage using their brake and their gas pedal and so on? So after the assessment is complete, I would write a report that goes to the physician, driver fitness and monitoring, and case manager if that's relevant. Basically saying that, yes, I recommend this individual be allowed to drive with this modification. They were assessed to be safe and so on. If I think that some training needs to happen, then, we'll make that recommendation as well. So once your physician gets the report saying that this particular modification is supported, they then complete their part, which is a driver's medical, and on that form, they would basically write out the modification that's being recommended for driving. Once driver fitness and monitoring receive both my report and the physician's driver's medical, they will then send a letter to the client. Driver fitness and monitoring are basically the ones who have the final say in whether a person can have a particular adaptation in place. So if we satisfy all of the requirements of driver fitness and monitoring, they will send a letter to the individual that they must take to registry. So that basically allows them to have a special code on their license that allows them to drive with that adaptation legally.